What is it that we can do as communication leaders in our own space and our own roles? What can we do as we work with communities of color and underserved? And I offer this, that as we engage communities, if you're a messenger or responsible for creating images, that we make those messages and images vibrant, strong, authentic, and appealing. Because what we have learned is that these communities' narratives matter.
So I think as we look at health equity at Lilly, I mean, we see it both as a global as well as just really local, because the world is full of many different local communities with very specific problems. Sure, there's continuity issues and all of that, but I guess we look at it also, how can we help today? But how can we also change the things that are in our systems all around the world? Whether it be social systems, regulatory systems, government systems, all of that. How do we help affect change on those levels? We've got to actually get in there and change the system. So last June, we launched the Lilly Racial Justice Initiative, or RJI, if you will. And we've been very focused on 5 areas that we are putting our money where our mouth is. It's people development, it is healthcare access, it's social impact, it's supplier diversity, and it's jobs. So what do we do, right? So that we help break down some of those systemic barriers that contribute to lack of care.
There is a growing recognition that 80% of someone's health outcomes are related to behavior and social and psychosocial issues and the social determinants of health, as opposed to the access and the actual healthcare treatment that they're receiving. So with this growing recognition, we had phenomenal leadership at Horizon that had this vision of us moving out of sort of traditional healthcare and starting to address these social and psychosocial issues. What I find is there still needs to be repeated education around what are social determinants of health and why should a provider and why should a payer care. So internally, externally, it's just over and over repeating the message and educating folks about sort of the role of and the value of the non-traditional services.
When I think about education, I think about pipeline programs that need to start in, say, elementary school and that need to go from there. I mean, a lot of times in healthcare, we've been focused on bringing more access and bringing more people from underrepresented communities into healthcare. And that's very difficult if you're starting at the higher learning level. You kind of need to go back to some of those formative years. Because initially, I didn't realize why my story was resonating so much with people. But I see that, there's definitely a need for more inclusion in healthcare. I was the only Black male out of 148 students who graduated from my medical school. And that shows a disturbing trend. We have to do something in order to bring more students, to get them more interested in healthcare, because it's something that makes economic sense overall. To have a healthier population overall, it benefits everybody. I know that there's always this question about trust. When patients come and interact in the healthcare system, I get the question a lot of times of why don't Black folks trust the healthcare system? And it's not just the healthcare system. It's the system overall. There have been unimaginable hardships dealt to African Americans over America's history. And not only in healthcare, we see this in policing, criminal justice, education, housing, employment, banking. African Americans walk into a hospital and they're usually there at a very vulnerable and powerless time. And then they're asked to trust the same system that's kind of indistinguishable from that system that is historically handed down unfairness and injustices. So what's the antidote? It's representation. I know that there are many people in the health fair, many people that I work with that are great people, have the best intentions for all people, no matter what their background is from, or they love the communities that they serve. But this is the perception that so many have. So my years in business have taught me that perception is an overarching necessity. on trying to change a long-standing mindset and build a trust.